Liposuction. Having a perfect figure has become the goal for many people who use liposuction. At his clinic, Dr. Moises Martin-Anaya has been treating all types of patient needs with the latest medical advances for 15 years. This is a technique designed to eliminate localized fat deposits that do not respond to exercise or dieting. Dr. Moises Martin-Anaya performs liposuction of several zones at the same time and can even combine it with other cosmetic procedures. The main site where triglycerides or neutral fats accumulate in the human body are the adipocytes. These triglycerides are highly concentrated deposits of metabolic energy and are composed of a hydrocarbonate chain. These adipocytes manufacture, store, and mobilize these fats as fuel, which our bodies will use as reserve energy. Up to adolescence, these cells increase in number and size. Afterwards, the accumulation of fat is mainly at the expense of the increase in size. Liposuction decreases the number of the cells, making the results permanent in principle. The fatty tissue is composed of a surface layer and another deeper and looser layer separated by an intermediate fascia. It is this deep layer that best responds to liposuction in principle. The distribution of fat in both sexes is quite different, due in part to the distribution of adherent zones and to hormonal stimulation. Liposuction is performed under local or general anesthesia and always in hospital. The equipment used for liposuction consists basically of a vacuum pump, a conductor tube, and cannulas. The ideal suction pressure is approximately 1 atmosphere. The cannulas have a blunt point and multiple openings, permitting effective liposuction with minimal trauma to the tissues. Small cutaneous incisions are made for the insertion of the cannula in almost invisible locations, or where they will not be noticed, depending on the zone to be treated. Generally, several incisions are needed for the treatment of a specific zone so that the area can be approached from several openings. Once the cannula is inserted in an opening, the surgeon manipulates it at the depth of the fat, creating tunnels with back and forth movements and suctioning the fat. In addition, the tunnels are made to cross each other from the different incisions to permit a softer and more homogeneous surface contour. Both deep and superficial liposuction are performed, creating extensive detachment and slimming of the subcutaneous level. The purpose of this detachment lies in the retraction effect of the skin, which permits it to mold itself to the new shape of the deep structure. Following the intervention, an elastic garment is placed over the zone as a bandage. In addition, it's recommended that the patient receive massages in the treated zones for lymphatic drainage.